Joining me now for more is pediatrician Dr. Dina Kulik. Dr. Kulik, first of all, thank you so much for joining us today.
You're welcome. Good morning.
Good morning. So you are in Ontario, so I want to get your thoughts on what's going on in that province, the changes coming from the provincial government when it comes to schools, the no more reporting cases in schools, as well as this change in cohorts.
It's all very confusing. I agree with the teacher that just spoke. We have been told all this time we should separate the kids out and to cohort to minimize class sizes. And now we're saying, well, we're all going back. Yes, 2 days delay, but we're going back, or the kids can go back. And we are not able to test them anymore. We're not going to be reporting anymore if they have COVID or they've been exposed. So presumably more and more kids will get exposed, and the teachers and the administrators. We don't have the capacity to test them, and they don't have to stay home for very long. If they are less than 12 or they're vaccinated, they can actually go back even if they've confirmed or suspected COVID after 5 days. And this is in the setting of a dramatic rise in cases. I think every kid, every adult that is exposed to others is likely going to be exposed or infected with this variant, which is scary when we've been trying so hard for 2 years to diligently prevent the spread of this illness.
I did want to get back to schools in just a moment, but specifically picking up on something that you've said, and it's a move that Ontario and some other provinces have made, is that if you are COVID positive but you've been vaccinated, you're allowed to cut your isolation time down from 10 to 5 days, followed by 5 days of masking. So what are your thoughts on this? How contagious could someone still be after 5 days?
We don't really know is part of the problem. So the CDC recommended a few weeks ago to cut this duration down to 5 days. Apparently now they're pulling back on that and saying maybe we should go back to a longer isolation period. I think this is unwise for sure. I think if you're able to keep your kids home, if you're able to stay away from other people at work and other places, you should. We are not aware specifically about how contagious you are day by day. We know that Omicron is contagious before someone's even symptomatic at all, which is obviously a big problem if we're just trying to avoid people that are sick. You can pass on this variant if you have no symptoms at all. But the thought is you're most contagious in those first couple of days. If you're able to, though, I really encourage you to stay away from others if you have confirmed or suspected a COVID for at least 10 days. For sure, you should be less symptomatic or ideally asymptomatic when you go back to being with other people again.
Okay, I did want to get back to schools now, with Quebec pushing back the start of their classes further. It was initially January 10th, I believe. Now it's January 17th. Ontario is pushing its start of school to January 5th, so only in a few days. Should Ontario be taking some advice here from Quebec and following their measures here?
I think the biggest thing is not just when are kids going back or if they're going back. We know that kids perform best in schools. Their mental health, their physical health, their emotional well-being is far, far better when they're in schools. This is their place to be. This is their work. We really should all be, getting together to figure out the best strategy to get kids back in schools. But the key is in a safe way. We need to actually work on increasing the ventilation, making sure there's actually good HEPA filters in each and every classroom, trying to minimize class sizes, making sure kids are in good masks, not fabric masks that are not shown to be particularly effective or protective against COVID-19, particularly Omicron. We want them in good quality masks. We need to make sure that all kids, all educators, anyone working in a school setting has access to these masks, and also really reevaluating paid sick leave for parents and people that work in schools. If you're sick, if your kids are sick, we need to allow families to take care of their kids at home. If someone is at risk of losing their job or not being able to pay the bills because their child or they are sick, this is going to lead to many more cases because people are going to go back to the environment where they could spread this variant if they're not able to be supported to stay home when they're sick.
And just finally here, Doctor, we don't have a lot of time, but in the few seconds we have left, I did want to get from you a bit more information about the risks of COVID for children. We've been told that in general, most cases, children are showing milder symptoms or milder cases of COVID illness. What are the risks for children, both short-term and long-term?
This is a great question. And it's true that most kids do very, very well with this variant and preceding variants. Adults do too. Most kids are asymptomatic or minimally symptomatic and don't get very sick. Some children have died, but very, very few. We don't know yet the long-term risks of COVID infection for kids. There are studies that show that long COVID, where some kids have ongoing fatigue or irritability, mental health concerns, this is a real thing and it does present in some children. But this is a new variant, and as has been the case for all of the pandemic, we're learning as we go. So yes, kids stay quite healthy by and large, but long-term side effects we don't really know at this point.
Okay, Dr. Dina Kulik, pediatrician, joining us on this today. Thank you so much for your insights.